the Indian government should not worry too much about Donald Trump, especially the foreign ministry. It really does not matter what Donald Trump thinks about India, because Donald Trump right now is between a rock and a hard place. Yes, he is trapped. He is getting hammered every day by the Iranians, and he cannot stop this war, which he has clearly lost. Now, if he stops this war, he is confronted with the Epstein files, and that music will be very hard for him to tackle. So therefore, Donald Trump is truly and well trapped. He is in a quagmire, but he does not deserve any sort of sympathy or empathy, because this man is a confirmed child molester. That is probably his biggest sin as far as I am concerned. Now, in the medical field, we have not an identical copy of Donald Trump, but there is some similarity with the man. And this person is Tony Fauci. Most of you know about him. He was the director, I think, from 1988 to 2022 of the National Institute of Allergy and Infectious Diseases in America. And he was arguably the COVID czar, and he laid down all the ground rules on COVID during the pandemic that took place in the last 5 years. Now, I have to talk about this man, Tony Fauci, for the simple reason that the latest New England Journal of Medicine, which was published yesterday, has an article from the University of Oxford on the use of a drug called Paxlovid in patients suffering from COVID-19. Now, these were people who had been vaccinated and were considered high risk for SARS-CoV-2 or COVID. They were randomized in an open label fashion. There were more than 4,200 patients, and actually this is a mixture of two studies done largely in England and Canada. We have 4,200 odd patients. The mean age is 55 years, and almost 63 or 65% were women. The result is that the administration of this drug, which is actually a combination of two drugs, two antiviral drugs, nirmatrelvir and ritonavir, and at a dose of 300 plus 100 twice a day, and this was given for 5 days. The result was that this drug Paxlovid failed to reduce significantly any hospital admissions or deaths in these patients with COVID-19. Remember, these were considered to be high-risk patients. Now, this is the paper in full. I have summarized the paper, and lo and behold, we have an editorial. We have an editorial, and there are two authors. One of them is Tony Fauci, and Tony Fauci acknowledges the fact that Paxlovid did not work in these patients with COVID-19. However, he emphasizes, he stresses that we should not overinterpret the results of this trial to conclude that the drug is ineffective. Maybe, he says, the drug could be used in certain subsets of patients, such as the elderly, the immunocompromised, and if we needed to reduce the duration of symptoms. Now, this is very far-fetched, because I must warn all of you, particularly if there are any doctors watching this, that Paxlovid is a very dangerous drug, not by itself, but when it interacts with other medicines. And as a cardiologist, you see, I am very dismayed that this drug interacts with just about every important drug used in cardiology. For instance, one of the commonest, if not the commonest arrhythmia in the world is atrial fibrillation. And this is seen currently in about 38 million people. It is speculated that the number will rise to 60 million people. In other words, 1 in every 3 person, adult, will have atrial fibrillation in his or her life. And the problem with atrial fibrillation is that there is a chance of an embolus, that is, the person concerned can have a stroke. And the incidence is 3 to 5% in a year, which is very high. Now, one of the drugs which is used all over the world is a drug called amiodarone, and this is freely available in India to counter atrial fibrillation, to control the heart rate, if not even to correct the arrhythmia. The big problem is that we have many patients with atrial fibrillation, especially in the subset in which it is being recommended by Tony Fauci. And these people with atrial fibrillation, if they are on amiodarone, then Paxlovid is a cause for great concern, because this could prove deadly. When it interacts with amiodarone, it reduces the metabolism of these drugs, and therefore it increases the blood levels, and this could lead to a very low heart rate, which is called bradycardia. This could be severe, there could be a heart block, but more importantly, there could be the prolongation of the QT interval, causing torsade de Pontis, which is a lethal ventricular tachycardia, which can lead to death. Now, the half-life of amiodarone is almost 1.5 months, maybe almost 2 months. So therefore, if a person above the age of 50 or in his or her 60s already on amiodarone, you cannot stop the amiodarone effectively, because the drug levels will remain. So therefore, giving Paxlovid in such a patient would be a disaster. Now, one of the drugs, a class of drugs which have to be used in patients with atrial fibrillation, are the blood thinners or the oral anticoagulants. Now again, Paxlovid increases the levels of these anticoagulants. These are called direct oral anticoagulants, such as apixaban, rivaroxaban, dabigatran. In all three, the levels are increased. So therefore, there would be a high chance of a bleeding problem, which anyway is found with these medicines. Next, we come to an anti-anginal drug, which is called ranolazine. Now, ranolazine, if used with Paxlovid, once again can cause the prolongation of the QT interval, and then again torsade de Pontis, which is actually can be a life-threatening ventricular tachycardia. So once again, we have a very serious problem. Apart from this, let's take heart failure. One drug which is used now, of course, and this is a combination of sacubitril with valsartan, and this in India is called by many names. There are many generic forms of this drug, and this is one very good drug which is used in heart failure with reduced ejection fraction. It can actually improve the function of the heart, but the problem is that when Paxlovid is used with this medicine, the drug levels could be increased substantially, and this could cause severe lowering of blood pressure, which is hypotension. And apart from this, there could be also an increased level of potassium in the human body, which is hyperkalemia. This could also be seen with another drug, which is eplerenone, which is used extensively in patients with heart failure. The level of eplerenone can also increase substantially, and with that hyperkalemia. Now, hyperkalemia is dangerous because this can cause ventricular fibrillation, cardiac arrest, and death. Apart from this, of course, then you all know that a large chunk of the world's population is on statins, either as a primary prophylactic or as a secondary prophylactic. I personally am not a great enthusiast for statins. I don't prescribe statins, very extensively, because I don't think this is as good as it is made, as it is sounded to be. But the fact is that many patients, many cardiac patients are on statins, and once again, this drug, Paxlovid, which is being recommended by Tony Fauci, can interact with statins, reduce their catabolism. That means it will increase their blood levels, and these blood levels can cause severe myopathy and also rhabdomyolysis, which is actually the muscles in the body get shattered, and this can close down your kidneys. Once again, this could be a very serious problem, and this is particularly seen with simvastatin. This could also be seen with atorvastatin and rosuvastatin, but to a lesser extent, but to a lower degree. But the fact remains that there are millions, there are lakhs of people on statins, and if Paxlovid is used in these patients, there could be a serious problem. So I have highlighted many problems with Paxlovid because it interacts dangerously with almost all medicines used in cardiology. In cardiology, we use what are called calcium channel blockers for high blood pressure. Once again, the levels of these drugs are increased, so there could be a severe fall in blood pressure, whether it is amlodipine or felodipine. And another important interaction is with clopidogrel and ticagrelor. These are very important antiplatelet drugs which are used always after a stent has been inserted, because they prevent microclots or small clots within the stents. This is called stent thrombosis. So remember, clopidogrel and ticagrelor are also called Brilinta. There are many generic forms of these two drugs in India, and they are extensively used in the world. The levels of these drugs could, now there is a negative interaction here. The levels don't increase, but actually they decrease. So once the level of clopidogrel or ticagrelor is reduced, then the chances of stent thrombosis are significantly increased. And stent thrombosis can be a disaster. It can be a catastrophe. It definitely causes a heart attack, a myocardial infarction, and it can also cause deaths. So now that we know that this particular medicine, which is being championed, which is being pitched by Tony Fauci, can cause such dangerous interactions with most drugs used in cardiology, one would be very careful. One would be not so gung-ho about Paxlovid as Tony Fauci is, because the peculiar thing here is that the New England Journal of Medicine, the latest issue, which it's just been published yesterday, has an article which is a randomized study, which is telling us that Paxlovid did not prevent hospital admissions or deaths in people suffering from COVID-19, and these were high-risk people, and the mean age was 55 years. The paper is concluding that the drug was more or less ineffective. Yet there is an editorial published for a drug which is neutral, which is not showing any advantages. And yet there is this editorial written by Tony Fauci which emphasizes that the drug can be used in selective patients. Now, why would Tony Fauci pitch for such a drug which has such serious interactions with most drugs used in cardiology? I would never use Paxlovid in a patient of COVID-19, ever. And I conclude by being quite puzzled. I find it very baffling. It is mind-boggling that the New England has this drug, which of course is made by Pfizer. I forgot to mention this. Maybe because this drug was made by Pfizer, and there is this study which is published, and despite the fact that the drug is not shown to be effective, the journal has been somehow incentivized or compelled or forced to get an editorial also on this drug, which is actually useless. And more importantly, crucially, the journal invites, of all the people, the journal invites Tony Fauci to write this editorial, and Tony Fauci is committed